We're talking with an infectious diseases doctor to get an update on the measles outbreak, what to know about the hantavirus during spring cleaning, and why to get the shingles vaccines if you're eligible.
Joining us this morning is Dr. Richard Martinello, Chief Medical Officer of Yale Medicine and Professor of Medicine and Pediatrics at Yale School of Medicine. Doctor, thank you for your time.
Good morning.
Good morning. Let's start with this. We know measles is still making headlines. We talk about it a lot here. How concerned are you or health professionals that the measles outbreaks could continue to spread and maybe spread to Connecticut?
Well, we remain very concerned about this. We've now seen over 700 individuals who have come down with measles in the United States, and 3 persons have died due to measles. Measles is really highly transmissible, but the good news is that it's easily preventable by getting vaccinated with an MMR vaccine.
Doctor, with 3 recent deaths from hantavirus, what do we need to know during spring cleaning? And I guess before we get to that, really, what is hantavirus for those who don't know?
Yeah, hantavirus is a virus, and it's something that is occasionally shed by mice, by rats, and other rodents, including rodents that we see here in Connecticut. And so while the virus itself is pretty uncommon in Connecticut, we see it more in the southwestern states, it is something that on occasion we do see. And I think what's important is that when people are cleaning up areas where there may have been mice or other rodents, so they make sure that they are wetting the area with a cleaning agent, with a disinfectant, and then wiping it up and trying to do what they can to keep the dust from that area getting into their lungs. And that can help them prevent hantavirus.
Interesting. Okay. And this is very interesting. We understand that there's recent research that shows that the shingles vaccine may help prevent dementia. Tell us more about that.
Yeah, there is a study that was published out of the UK this last week. And what they did was they studied persons who were elderly and became eligible to get vaccinated against the chickenpox virus about 10 years ago. And they were able to divide the group up into 2 different parts. One 1 week older who were not eligible for the vaccine. And the second group was those who were about 1 week younger and were eligible for the vaccine. And what they found was that very few people in the older group were vaccinated, whereas about 50% of the younger group were vaccinated. And they saw about 20% less dementia in the group that had been vaccinated.
Wow.
Scientists for a long time have thought that viruses like the chickenpox virus may be a cause of dementia. And this gives us not only good reason to think that that's in fact true, but also by getting vaccinated against shingles, it may help to protect us in part against dementia.
All right. Very interesting. Dr. Martinello, thank you so much for being with us as well.
Thank you.
Thank you.